County. And thank you, Efrain. So I'd like to welcome you all to our monthly Cisne Forum. Our topic for this month is community health worker services in Monterey County and homeless resources. And we have our first guest speakers that come to talk to us about the VITA project. Many of you have probably heard about it and the efforts that they've done. So we would like to highlight the services that they provide. Thank you for joining us. Please introduce yourselves. The floor is all yours.
Good morning. Annie, could we get share screening privileges, please?
Yes, of course.
Thank you. Can you guys see my screen? Okay, I went forward. All righty. Well, good morning, everyone. As we had mentioned, my name is Alma Oliveros. I am with Mujeres en Acción. I'm the CHW coordinator with the VITA project, and I'll let Iris introduce herself as well.
Hello again, Iris Delgadillo. I'm also the CHW coordinator for building healthy communities. Thank you all for having us here.
And I think just to go over what VITA actually stands for, it's Virus Integrated Distribution of Aid. So that's what VITA stands for when you hear us use that acronym. So let me see. Give me 1 second. It's not letting me go to the next one. Let me stop sharing. Sorry about that. I don't know why it's not working. Iris, do you think you would be able to share your screen? Mine's acting funny.
Yeah, I can share mine.
The new world of technology.
There we go. We can see it.
Perfect. And then slideshow. Okay.
Okay, so just to give a little bit of background of how the VITA project started. So in December of 2020, the County of Monterey Board of Supervisors approved $4.9 million to support hiring 100 community-based health workers in Monterey County to decrease the COVID-19 infection rate in disproportionately impacted census tracts. The Community Foundation for Monterey County, CFMC, and the County of Monterey are partners in distributing the funds to community-based organizations able to recruit, train, and hire community health workers, CHWs, to be present in high-risk communities, HPI census tracts. The CHWs project is intended to reduce the spread of virus by identifying residents that are infected and use cause management to identify needs and quickly connect them to resources they need. To successfully isolate or quarantine, the CHW program will also support vaccination through education and outreach programs. Just to give a little bit more of background, this project consisted of a lot of background work before it was actually funded. A lot of organizations, nonprofits, including Mujeres en Acción, and with the help of COPA, was able to make over 2,000 phone calls to people and see what the need was during the pandemic. We were able to hear many stories from families where they were struggling, where many families members lost their jobs due to the pandemic. Their hours were reduced significantly. People were unable to pay the rent. So the need was there and we wanted to do something about it.
Thank you, Alma. So the pandemic definitely just brought all of the social issues that were already there more to light. So the VITA project has really given us the opportunity and the funds to go out in the community and provide education and really focus on prevention. We, as community health workers, we're trained by CDPH to administer tests. We also register folks to get their COVID vaccines, their boosters. We know that there's a lot of changes when it comes to the regulations of COVID. So we've been able to get that information straight from the source, from the health department, and pass that information out to the community. And we do that by doing outreach in places where community is. So we go to local churches, grocery stores like La Princesa. At one point we did it at Santa Fe. And we do that again to meet people where they are. Also partnerships with the school districts. Building Healthy Communities has a partnership with AUSD and MPUSD. So we're able to connect with parents and again, just pass on those messages. So CHWs serve as trusted messengers. We were really adamant about choosing CHWs within the community. So the CHWs that serve in Seaside live in Seaside and have lived in Seaside for years. So they're part of the community, and they're vecinos, they're neighbors, they're comadres. They're, again, that relationship just really helps community trust us. So yeah, CHWs are also trained and equipped to deliver culturally relevant messaging. And again, that just comes from being a part of the community. The Monterey County Health Department and the Community Foundation and other organizations. We've also worked with Clínica de Salud to really build up their capacity so that they're able to deliver the messages in also an accessible way, but also, again, delivering the information accurately. So the CBOs that are a part of the VIDA project are now 8 organizations, and that ranges from South County all the way to North County. BHC and Mujeres are just 2 of the 8, like I mentioned. So we all are different parts of the community, and we have our the things that make us special. So yeah, the kind of like I mentioned, I guess the way that we conduct outreach and education is basically to provide resources to hard to reach communities. So those are some of the methods that we use to do that outreach.
Okay, and then just to highlight some of the key VIDA successes. So we have registered over 7,000 community members for vaccines. And these numbers are from, I want to say, like a good 3 or 4 months ago. So the numbers have gone up. We have had interactions with probably over 400,000 people by now. The interactions, materials, resources provided to 130,000 people. And then addressing needs of quarantine and isolation. And when we say we're addressing the needs, we're that person that's in the middle of for those people that don't have family members, that don't have anyone that is able to support them when they're unable to leave their house. And what do I mean by this? I can give a clear example. Let's say I'm here with my family and I were to test positive. And I obviously can't go to the grocery store. I obviously can't go out and go anywhere, to be honest, because I'm afraid of getting anyone else sick. So we provide that connection to the person where if they need food, if they need water, if they need feminine products, if they need diapers for their babies, we deliver it to their footstep of their house. So we try to avoid any barrier that's in the middle of them having to leave their house due to basic necessities. So yeah, I'll leave that there.
Thank you, Alma. And I also wanted to mention, at one point, we were offering wage replacement when wage replacement wasn't provided by the state, the 80 hours. So that was something that we also did with the help of Action Council. And also 211 was offering wage replacement at one point. I know we're 2 years into the pandemic, so resources are scarcer, more scarce now. But I also did want to highlight that. That's also a way we addressed isolation and quarantine needs. So here are some of the Vida values, goals, and principles of the project. First off, health equity. Our goal is for everyone to have the opportunity to be as healthy as possible. And something that we've recently implemented is helping folks get access to healthcare. So with the recent expansion of Medi-Cal, our teams have been trained on how to fill out applications when it comes to Cal benefits or benefits Cal. So we can help with food stamps. We can also help with Medi-Cal applications. And that ranges from, let's say someone was on emergency Medi-Cal and they now have access to, now have full scope Medi-Cal, and they get a letter in the mail. We know that there's a lot of barriers when it comes to that, whether that be language. So our CHWs again serve as a resource themselves in saying like, hey, this is what this letter means. These are the next steps that you need to do. Our CHWs can also help residents scan their documents and really just help them navigate the system. Another thing that we do is reduce the risk of COVID. So like we mentioned before, the isolation and quarantine supports and providing COVID testing and vaccine registration. And again, our COVID test sites, we have done our best to keep these sites open at later times than other clinics up until 6:30. We know that folks may work in the fields or the embaques and may get out of work at a later time. So we've tried to make it as accessible as possible. And at one point we were also going to folks' doorstep to test them if someone was positive and they needed testing for the rest of their family. We know that testing is more accessible now. There's at-home tests, but again, we've gone through various shifts as the circumstances have changed with the pandemic. So yeah, I will pass it over to Alma for the next slide.
Alrighty. So resources provided. I think Edie's mentioned a lot of these already, so I won't go over them too much, but like we had mentioned, we would help people with the rental and utilities assistance. We would help them fill out the application. At one point, United Way was helping hundreds, even thousands of people with rental assistance and utility assistance were those that were affected by the pandemic. So we were that middle person. And I think this is like what we try to focus on the most is closing those gaps or those barriers or those language barriers for people to apply for programs that are already out there. They just don't have the information or are scared to apply because they don't know how to fill out the application online or because they're afraid of what this may cause in the future for them. So we were able to do that. The wage replacement, as mentioned, funeral expenses, that was a huge one. A lot of families suffered deaths, unfortunately, due to the pandemic, and we were able to help connect them to people that were able to support them with the bills regarding the funeral expenses, as they were not expecting this. Baby formula, diapers, mental health services has been a huge one. We've recently been trained as well by the health department as well to do that, a little bit of mental health support for the community. Obviously not as professionals, but to be that person that's there to listen to people, as a lot of people have lost connection with a lot of people due to the pandemic. And then of course our new, the benefits Cal, and that was mentioned already.
Alrighty. So we did also want to highlight a bit about our orgs. So like I mentioned, I'm the VIDA coordinator, the CHW coordinator for VIDA, for building healthy communities. So our team serves Salinas, Marina, Seaside area. And the flyer that we have here, we can also share out with everyone. We did want to highlight that all of the teams are trained in HIPAA because we are working with very sensitive information. Now that we were working with COVID testing and now medical applications. So again, just to ensure everyone's privacy and safety. And again, some of where our CHWs are located. Our CHWs are bilingual, and that's something to highlight. And again, we offer COVID testing, home test kits, PCR appointments, we can help with that, and also vaccine registration. So I kind of mentioned it at the beginning about the relationships that we have with school districts. And again, we're kind of working on having folks within the community like organize and really listening to the needs of the community, and uplifting that and bringing that to systems so that they can hear it straight from the source. And that's something that we really value within our organization. So yeah, there's also the number there if you'd like to jot it down, but we'll also share.
And for those of you that are joining us via phone, if you have a way to jot it down, please drive safely. 831-272-2002. Once again, I will repeat that, 831-272-2002.
Thank you, Annie.
Alrighty. Just to follow up with what Elise had mentioned. So we're several organizations, I believe we're 8 now. And then just to explain a little bit more, each organization is located in different locations throughout the county based on what we had mentioned, where the CHWs live. So we are actually located in King City, Greenfield, Soledad, Salinas, Castroville, and Prunedale, offering the same services. And we will be sharing the flyers. We also have our phone number here. And then just to uplift a little bit of the work that we have done, I'm very proud to say that we were able to test over 200 people that were going to be in a retreat for women. And since we did test them, one person came back positive. And we avoided 200 women from getting exposed, possibly being contagious with COVID-19. So that was a very big event for us. We've also helped UFW with food distributions. We're always willing to partner with organizations. We partner with local churches as well to reach the community in their faith places. We also have the privilege to work with the mobile van, and that reaches all the rural areas. So we'll take vaccine and testing to them, such as places like San Nardo, San Lucas, Watsonville, Prunedale, places where people are normally not reached.
So if there's a contact number where if an agency would like to request your presence, would it be that 272-2002 number to call?
I think it would be my personal number or this number, Annie, just as Mujeres en Acción is the organization that's working directly with the mobile van at this time.
Okay, and for those of you that are joining us via phone or mobile or by car, the number is 831-205-0044. I see information, I see a chat question that's basically asking, can you give a little more information about your rental and utility assistance? Is there still funding for that? And if so, quickly, what is the criteria and how much, and what is the cap? And we're going to go on into the Q&A session. Out of essence of time, our second speaker is ready, and we want to respect her time as well. So we're going to go in and get into the Q&A at this point. And someone would like to know a little bit more about the quality, utility and rental assistance you provide and how we could refer families to access that, if it's still available.
Yeah, of course. Unfortunately, their funds have been exhausted. So there's no longer funding available. The applications that they are processing at this time are applications that were submitted before time. There's always new programs that pop up here and there. I know there's one at the CET in Soledad where they're offering people not only to their students, but people that are struggling with rent. They'll pay up to $650 of their rent if they qualify. So there isn't funding from United Way as of this point, or from our organization, because funding was exhausted, but there's always new opportunities that we find out about from the community.
And also Catholic Charities offers rental assistance as well. So there are other, so I would encourage you that are on the call or joining us via call 211 if you encounter a family that is struggling with rental assistance, utility assistance. There's the HEAP program, the LIHEAP program for the utility assistance, and you can always call 211 and they will have the most updated information on who has funding and who's available. Any other questions for Alma or Edie at this time regarding the VITA project? Okay, let's give them a round of applause. Thank you so much for joining us today. If you have a website or somewhere where you have like a calendar of where your workers will be, if you can put it in the chat box, that would be great, so we can save it on our favorites. I think that would be very helpful to our colleagues and CPOs on the call. Maybe a link to your or a link to your resources of the services you offer. Thank you so much. So going on to our next speaker, thank you for patiently waiting, Lauren. The floor is all yours. Please introduce yourself, and if you have your presentation ready, we'll give you access to share your screen.
Hi, can you see my screen now? Perfect. Thank you all for having me. I am Lauren Walters, she and ella pronouns, and I'm here to talk about Planned Parenthood Marmontes and Laces pilot. I'm going to try to zoom through this information because I want you to hear from folks who actually engaged in the project. So away we go. So we had a pilot goal to essentially assess the feasibility of a training model that we were running internally to train folks on how to teach sex ed in their communities. The target population were adult Spanish speakers. And the reason and rationale for trying to train other folks in the community to do this is that we just want more sex educators in the community. We know that we're not the only ones who can deliver this information. And we also trust that our community members sometimes can deliver the information better than us because they have the relationships. So that is what we set out to do. So what happened? We offered the pilot from April to June of this past 2022. And the pilot partners were offered training in both general and specific sexuality information. They were offered the supplies to implement at least one sexuality session with their community. And they were offered some coaching support that came in both formal and informal modalities. So I'll talk a little bit more about the details of each one. The training, there were two parts of the training. The first was an onboarding that focused on more general sexuality topics. So things like how to talk about values, differing values surrounding sexuality in your community, and reproductive and social justice, and how to answer challenging questions and facilitating difficult scenarios. So these were all basic skills that we considered to be skills necessary for teaching this kind of stigmatized topic. And you can see the specs of those training hours and how much time was asked of our pilot participants. And it's important to note that all of this training was delivered in Spanish because our expectation was that our pilot partners would deliver the lessons in Spanish. So we wanted to start from there. So the second part of our training were those focused sexual health modules. So we have 3 topics that folks could choose to teach in their community. They were healthy relationships, youth-adult communication about sexuality, and safer sex, which talked about things like birth control, sexually transmitted infection, and consent. Our training took a total of 3 hours per topic because we wanted to give them a little bit more background through an equity-centered community design. Sometimes when we talk about these topics, we need to know what's happened in the past to inform how we answer questions that folks in the community have, because it's based on experiences that they've had. And then we trained in a watch, learn, do model. So for the second part of the training, the folks would watch us do part of the lesson and then practice part of the lesson before they went out into the community. Folks had to mandatorily attend all of the training for the topic that they wanted to teach, but they could choose which topics that they wanted to be trained on. Also delivered in Spanish. So far as supplies were concerned, we knew that folks would be facilitating in person or virtual or in hybrid modalities is what we were prepared for. So some people in person and some people on a screen. So whichever they chose, we were able to offer some technology and supplies for how they were teaching, whether it be in person, virtual, or a combination of both. And then we asked for folks to administer surveys as well. We wanted to know how the community was receiving this information because that's really important. We need to adjust our lessons if the community is not resonating with what we're teaching. And then we asked for facilitator feedback. How did it go for them teaching this stigmatized topics in their communities so that we can make adjustments and also offer additional training if necessary. Coaching support that came informally and formally. We had our Planned Parenthood assigned coaches who have been teaching sexuality for a long time. And any of our pilot partners could tap those coaches if they needed help or support or needed to talk through a difficult situation that they encountered in their plática. And then we also had some informal mechanisms that came via something we call Mighty Network. It looks like a Facebook page, but it's private, and facilitators can talk to each other on that page. They can grab any resources they need for the lesson. They can grab the lesson itself, the surveys, everything they need is there. So that's where we have the support. And our ask was, within the 3 months, facilitate at least one sexuality lesson with an adult Spanish-speaking group in your community. That was our only parameter after all of this training. So you might be asking yourself, what actually happened? So we enrolled 3 different partner sites and trained 11 partner facilitators. They came from 2 different counties here in Monterey County and then also in Stanislaus County. And they delivered 5 pláticas and they tested all 3 of the topics that I mentioned. So youth adult communication about sexuality, safer sex, and healthy relationships. And they reached 107 people within about a month time. So that was so exciting. So now I'd like to turn it over. I've only prepared 2 people for this, but I know there's a couple other people on the call who engaged in the pilot. But Myra and Esteban from MCOE. We're pilot partners. And so I just wanted to give an opportunity for you all to answer a couple questions. So my first question is, why did your organization feel it was important to be involved in this program?
Yeah, well, after going out to the community, seeing some of the type of housing that our students have, it was important for them to know, one, the resource, and second of all, to make them more aware of the type of situations that they might get themselves into. And me coming from their background, uh, thinking about my experience and the cultural, sometimes it's cultural barriers and also like the English barrier, sometimes they can't have access to this type of information. And even from family members, people I know that they lack of this knowledge. So I thought that would be a great opportunity, now that we have the information, to not just kind of like use it for ourselves, but also share this good information to them. And the most important thing is because they need it. So it's needed. They sometimes they live on hotels, big population of our students living in hotels, and they could get into these, it could be at risk of many sexual transmitted diseases and stuff. So it's a good thing to advocate for them, and so they're aware of what they're doing, so they're aware of what's around them.
Just to add to Esteban, I think I was brought in. Esteban talked to me about it. We're a team. So yeah, let's go for it and do it, since we do have, Lauren, and we had the resources, and we tried it as a pilot. It was just an experience for us to do. So pretty much what Esteban said, just make them aware of their surroundings, where they're at, and just teach them and help them and coach them and try to be there to support them and advocate for them and give them the information we have, so they can have better relationships. I think that's about it. Thanks.
Awesome. And then my next question is about the training that you engaged in. So how do you feel that training prepared you to go out and talk about these stigmatized topics before?
I think that the trainings were so great, to be honest with you, Lauren. I like that they talked about the specific topic, and then they elaborated, like, this is what they can ask, this is what they could say, and this is where you come. And then they switch the role on us. So now it's like, we're gonna teach it, in 5 minutes, but back to our groups or whatever. And so I just think it was very engaging. It was very quick for us to learn how to do it. And we had the manual in front of us if we were stuck on anything, or what if, a student asked this question. I think that, it was kind of hard to be put on the spot because we had everything in front of us. Sure, there's probably going to be some questions, but I think Esteban was really good. And like, if I didn't know something, he would cover. If he didn't know, I, go in. So, I mean, the training overall, I mean, I thought we've learned a lot. And even if we didn't know something there, we learned. So it was really good and engaging. I really enjoyed it. And I learned a lot as well.
I think I'm hearing that if you didn't know the answer to questions, you could lean on your co-facilitator. If you still didn't know together, we always have that caveat of, we don't want to give the wrong information, so we'll get back to our participants. And then that manual in front of you all too has a lot of information just in there for you all.
Yes. And also the network, like you said, the Facebook, I really like that because it was like really chatting, and, our facilitators or our group coaches, they would always respond in a timely manner. So, I mean, I really like that. What is it called? Oh my God, that, your Facebook, but it was the Mighty Networks layout. Yeah, thanks.
So I got a time check from Ephraim. We only have 5 minutes, so I want you all to share which lesson did you teach to your community and how was the content received by your participants?
The topic was healthy relationships, and they loved it, and see their eyes kind of like popping out as we're going to like signs of what's a healthy relation. Um, and at the end, some of them took pictures of like the where to go if they needed more help, and I think that was the most important thing. Not only did they know about it, but you can see that some of them were like, hey, I might not be on a healthy relation, or like, oh wow, I know someone that definitely is not in a healthy relation. So to me, that was um, a pretty good moment to kind of celebrate, because they know how to detect that, and also to see that some of them will take the information and go beyond and share it with someone, be like, hey, I think you might need this. So I think that's a great project. um and probably never seen, or they don't know what's like bad relation, and everybody says, like, oh, it's everybody goes through this, so like everybody has this, so this is normal, and get them out of that and really teach them what should be normal, what shouldn't be normal. Like, that doesn't make it a perfect lifestyle. So like if it's something that we're going on to as a community, that doesn't necessarily make it like a good thing.
So just to add to Esteban, we did it in a presentation and it worked out where, we engaged our students into reading the question, do you think this situation is toxic, is healthy, is not, and why? So our students were actually, saying it out loud. That's toxic, that's healthy relationship. And so then we would talk about it. Oh, really? Is it really healthy? And then we would elaborate, based how we were coached. So it was really good, going back and forth with our students. And we were working with out-of-school youth. So they're from ages 16 to 21. And so what I really, like Esteban said, their eyes just popped out like, really? I couldn't believe that. But what I really liked was that at the end there was a resource for domestic violence, and everyone, like, I kid you not, they were taking out their phones and taking a picture of the contact information. And I'm like, well, that's very good to know, and I hope they bring it out to someone that they know is in a domestic violence relation, or for them to open their eyes and see that there's more resources out there that can help. So I really like doing this. Again, giving our students the most information we can give them is key for success, for trying to better themselves and everyone around them.
Wonderful, wonderful news. There is a question in the chat box for you, Lauren. Do you do presentations for special need constituencies? Is there like a special tailored presentation you can offer? We have Special Kids Connect and other agencies that serve our special needs population in Monterey County. If so, can you put the contact information of where they would call, and also the agency phone number if any of our participants in the Cisne are interested in being part of this education piece? You can reach out to Lauren and she will provide the phone number in the chat box.
Yeah, so that's a great question. I don't work on the special education team, but we do have one. And we are working on some digital products for that population. It's so important, and sexuality is a topic that doesn't often get discussed for folks with special needs. So you can reach out to me directly and we can make sure to get you set up. I did want to thank the two pilot participants for sharing. I heard a lot of connections to care that happened. I heard a lot of learning and critical thinking in the program. So that's all things that we love. So wrapping up what's next, we're looking at the data and reporting from the pilot, and we're adjusting our program slightly for that. And we've just been cleared to do more capacity building surrounding this project. So in one way, shape, or form, we're going to be onboarding more partners and continuing training the community because it was so impactful. I know MCOE said, we're so glad to be able to deliver ourselves because a lot of our community partners can't come out at night when we need to teach. And so being able to teach ourselves is a big, important aspect of being in this program. So I encourage folks, if they want to know more, contact me. There's my email is the easiest way to contact me. So you can jot it down, and that's what I have for today.
Round of applause for Lauren, Esteban, and Maida, and everyone else who participated in this pilot project. Thank you so much. Are there any questions for Lauren, for Maida, or Esteban at this point, at this time?
Can I say something?
Yes, yes, Otilia.
Well, I really like that presentation. Congratulations, Mayra, and este muchacho se me olvidó su nombre. Gracias. En nuestra comunidad hay muchos jóvenes ahorita, especialmente yo tengo unos vecinos jovencitos, no creo que tengan 18 años, ya tienen hasta bebé, y me preocupa porque el futuro de sus hijos. I'm sorry, I'm talking in Spanish. We have neighbors, very young neighbors in my community. They have babies, and those I think the babies could be is sad because it's young people raising babies. They don't full develop, and then later on they will break those relationship, and then they're gonna have another partner, and they're gonna start moving and having multiple partners and children. And I think it is a good. Thank you, Esteban and Mayra, for doing this, because we can educate this young community, and they can move on, and they can have the knowledge what is like raising a child in a different with a different knowledge. They can see the differences and for the future. Yes, thank you so much.
Thank you, Otilia. Thank you. So true. Thank you for your feedback. Any other questions for Lauren or for any of her participants? Okay, seeing none, we'll go on to our next speakers. Thank you so much once again, Lauren, and we look forward to, hearing more of your wonderful work. Next on the agenda, and I apologize for the delay, we are now into our third and final speakers. They will present to you information and resources on the Homeless Coalition of Monterey County. Armando and Jake, are you on the call?
Yes, hi everyone. My name is Jake Fenton. Oh, sorry, were you talking, Armando?
Nope.
Also, yeah, my name is Jake Fenton, and I'm the COC Program Coordinator for the Coalition of Homeless Services Providers. COC stands for Continuum of Care, and we will explain what that means shortly. And for short, we often go by CHSP. So if you see that, just know that that stands for our organization.
Good morning, everybody. My name is Armando Elizondo, and I am the CARS Program Coordinator for the Coalition of Homeless Services Providers. And yeah, I think we live in a world of acronyms. So you're going to get a lot of acronyms from us, and we'll explain a little bit about what they are, what they stand for, and what they mean as we progress through our presentation. We're really excited to be here, by the way. I feel like I just got invited to the best party of the year.
And we're excited to have you guys. Thank you.
Sorry if you sometimes hear an echo because we have an open office, so sometimes it's just inevitable. Okay, so today what we'd like to share with you all is we'd like to first give you a little background on what we do, because what we do, it can be often difficult to tell based on our name. And then we're going to go into telling you about all the services and resources that are available in our community for people that are at risk of or experiencing homelessness. And I'll pass it back over to Armando.
Yeah, so what is the continuum of care? When you hear the acronym COC, they're talking about the continuum of care. And the continuum of care basically is a program or a mentality that was put out by the federal government, basically HUD. And so when they did that, they wanted to bring the community together and have everybody commit, and with the goal to end homelessness. And what that means was partnering a bunch of different agencies who build that continuum of care, who are different levels, to try to get, the client or the customer or the consumer or whatever you want to call the community member who is experiencing or is in danger of experiencing homelessness. They want to get them where they're at. That could be at where they're just barely missed one payment of rent, or they're lost their job and they're thinking further down the road. And so the organizations that we work with, and they all deal with the homeless sector. And so anybody who is receiving HUD funding in Monterey and San Benito counties partners with us. And what we do is we're the lead agency in that. And basically it's a system. And so we'll talk a little bit more as we go into further details. Back to you, Jake.
Yeah, so some of the main functions of a COC are to coordinate between agencies, to collect and analyze data, to always be trying to improve. We apply for and provide the funding to the agencies, and then we try and promote within the community. And Armando did mention that we are the lead agency for the COC. So essentially, we work with a whole bunch of organizations, and we all work together to try and address homelessness together. And then within our community, there are several types of resources, including emergency shelters, community kitchens and meals, transitional housing, rental assistance, permanent housing, and day centers and resource centers, and more, and social services, energy assistance, and health and wellness. And as one of the previous presenters mentioned, United Way is a great resource for finding information on resources in our community. You can always give them a call, and they should be aware of everything that I'm gonna continue to present. And I do want to, as I'm going to move on to discuss specific resources, I do want to let you know that I'm not going to go through each of these individually, because really in our community, there are a lot of resources, and we just more put this here so you could sort of get an idea of everything that's available. And then I did also want to let you know that all this information is in a resource guide that we've created, and we update usually about once a year. And I will provide a link to the chat in that as well. And we also have a Spanish version of that as well. And the nice thing about the resource guide is you can print it out into a little booklet, and it's a really easy thing to just give to people that are interested in the resources. But I'll go through a few of these. I'll highlight specific shelters or specific types of shelters in our area at first. We have domestic violence shelters. There's shelters for people who recently had a procedure done and need a place to essentially heal. There's a youth shelter. There are shelters for families. And then there are there's a program called iHelp, which is an interesting program. And the way that works is they pick you up and they take you to a local, it's a night shelter. They take you to a local church and they provide you dinner and a place to stay. There are some safe parking programs, although I'm not totally sure if these are still active, but I know they were going on, and they're currently working on reintroducing these back into the community. And these essentially give people with RVs or cars a safe place to park overnight. Victory Mission is a night shelter for men. And one thing about these shelters I should mention is oftentimes they are fairly full, but the night shelters like Victory Mission often still have openings. There are shelters or resources for veterans. And then the Share Center I'd like to highlight is actually, it's a fairly new shelter, and it's in Salinas, and it's huge and it's really nice. And there's 128 beds there, and they provide a place to stay, and then they provide with services in order to try and find a place to move on to. And then within our community, there are also, as I mentioned before, community kitchens and meals. And I'll just go through these and show you, but there's several of these in our community. And some of the shelters and
This is
kitchens sort
great
of.
information, Jake. I just want to pause and say thank you for putting it all in one place. If we can get a copy of it so we can distribute it to our Cisne listserv. There's literally hundreds on that listserv. Just raise your thumb if you find these resources, information, you can apply it to your daily work serving families. Just kind of thumbs up. This is what I'm talking about. Look at those thumbs.
Wow, that's a lot of thumbs.
You know,
one of the things
housing,
that-
health, and this is why we bring the Cisne Forum to our community every month, because we want to empower our agencies that serve those most in need with resources just like this. So, you know, I just want to pause and just say thank you for taking the time to create this presentation and bringing it to the hands of those that can deliver the message. Thank you.
I think we should mention that if you look at the screen on your right-hand side, you see a bunch of screens, little people, right? You have the continuum of care. That's what that means. It's a community-based programs that have all come together for one purpose. And for us, as a lead COC, that's trying to end homelessness. We had our first homeless summit this summer. I mean, this summer. It was huge. It was a great success. We're looking at doing it again. We're just deciding on whether we're going to do it every other year or yearly. One of the main things that we do here too is, you want to keep going with the screens, or should I go into cars?
Yeah, I'll go through these quickly and then I'll let you get into cars. Yeah, so is a lot of information here. I don't want to spend all our time going through everything because like I said, I will be providing you with a link to the resource guide, which is where all this information came from, which is better for distribution anyway than the PowerPoint. So yeah, social services and energy assistance. There's drop-in centers scattered all throughout our county. There's health and wellness centers. There's places for people that are trying to recover from drug issues. And then I'll let Armando get into what he was mentioning. We have a program in our community called the Coordinated Entry System, and I'll let him explain that to you further.
Yeah, one of the main things that we also do as the lead agency is that anybody who works with the homeless population, or anybody who's struggling and is unsheltered, we hold policy. We dictate policy. We rewrite policy. For anybody who's working with the COC. And so I'm blown away. When I first started working here, I was blown away by the amount of stuff that this organization did. And I was like, whoa, I had no idea. I used to be on the other side doing CARS assessments. And anybody who's seeking housing in Monterey County and wants to access these programs that we have, they have to do what's called, some of them for housing, they have to do what's called a CARS assessment. And CARS stands for Coordinated Assessment and Referral System. And basically it's a software, it's a program. But it's, if you see on the screen, it's called CARS and the VSPDAT, right? CARS, we know is the acronym for the Coordinated Assessment and Referral System. And the VSPDAT is what's called a Vulnerability Index. And so anybody who's seeking services or trying to get housed has to get a CARS assessment done. By the way that they respond to the questions, that assessment will give them, it's a point system that will determine how vulnerable they are. And so the COC and the CARS program is trying to get the most vulnerable people off the streets first. Once you get the CARS assessment, then you get placed on the master list. All the organizations that are working with the COC in our coalition have all agreed to use this one system and one master list. So when a receiving agency has an opportunity, let's just say that Housing Resource Center has an opportunity. Housing Resource Center is one of the agencies that we work with. That agency sends a referral to the CARS system. The CARS system runs a report, and it does the vulnerability index and the time homeless. And so it'll gather a bunch of numbers. We don't see names, we see numbers. It'll start from the top with the highest, the most vulnerable, and then those are the people that we send out first. And so that's what the CARS system does. And we here at the coalition, we monitor that system. We review the system, we audit files, we're here for tech support. Any organization who's using HMIS, which is the Homeless Management and Information System. All these programs are connected by this system. And so that's what we do. We monitor the system. We have another department who runs the HMIS part, the COC as Jake's department, the CARS department, the data department. I mean, it's amazing. But that's in a nutshell, that's what the CARS and the VSPDAT and the lead COC, that's basically what we do here. All of the agencies that are working, that are receiving any HUD funding, have to use the CARS system. And so that's what we do too. We monitor and then we evaluate programs. We offer tech support. We offer trainings. There's a bunch of stuff that we do here. Organizations can also join the coalition. And I don't know a lot about that. That's not my department, but it is possible. And so maybe Jake knows a little bit more about that than I do. But anyways, in a nutshell, that's what we do here at the coalition and the CARS assessment. These are some of the participating agencies. One of the things that by having all these participating agencies all get together and agree to partner together is if someone is seeking services, they can go to any one of these agencies, whether they qualify or not to be enrolled in their program, and have at least at minimum an assessment done, the CARS assessment. And so that helps, someone who's struggling with homelessness to have to travel to each individual program and enroll in those programs. Using one system and one list, it's not a first come, first serve wait list, it's a vulnerability index. So those that are most vulnerable, they get higher up on the list, and those are the ones that access services first. All these agencies here have agreed, they have MOUs with us, memorandums of understanding of how they're gonna, work with CARS and provide services to the community. And so these are the partnering agencies that have decided to do that with us.
And when you participate in CARS, there are often several types of assistance, including rapid rehousing, which essentially tries to get you back into housing as soon as possible. And then rental assistance, which is pretty straightforward. There are several agencies that can help with these types of assistance. And then there are transitional housing programs, which are temporary housing, usually less than 24 months. And then they try and help you potentially work on your skills and things like that. And then try and work with you to get into a permanent housing. And then you can also be placed into permanent housing. And there are several agencies in our area that provide permanent housing. And yeah, so that's pretty much our presentation. Thank you so much for listening. And we love to share this information because we really would like to spread it across as many people as possible. And I will be, as I said, I will be providing you with our resource guide in both English and Spanish. And then if you do ever have any questions, you're always welcome to email us, or you can give us a call. I can also include our phone number. And then I would say, because our area and our continuum of care is always changing, sometimes the resources are not always 100% up to date. So you're always welcome to give us a call, or on our resource guide, we try and update it at least once a year. So on our website, usually we'll have the most recent version of the resource guide.
Wonderful presentation, Jake, Armando.
I think
Welcome to
it's
the
important to
Cisne
mention-
Forum. Thank you.
Thank
This
you.
is the
Thank you for having
time.
us.
Yeah, for
think it's
question
important-
and answers. There's a question there who asked from Dana. I'm sorry if I missed it, but how can someone get a CARS assessment? Can someone self-refer? Can you answer that question again? And also add if there's any CBOs on the call that would be interested in signing a MOU with you and become one of the CARS agencies, how do they do that?
So I can definitely answer the CARS assessment portion of that. Yeah, in order, you don't have to have a referral. You don't have to have any letter, judgment, nothing like that. To get a CARS assessment, the only thing you need is to be in danger of becoming homeless or are already experiencing homelessness. If you go to our website, which is chsp.org, and then on the top right-hand button, there'll be a little link, little buttons. One of them say CARS or Continuum of Care, and then CARS. Once you get to CARS, there is a list of agencies that can help anybody get a CARS assessment done. Some are in Monterey, Seaside, Marina, Salinas. I'm not sure about South County just yet, but we do have, there you go, just like that. There's a list of agencies right there. And so any one of those, you'll have to call them individually. Some of them do have walk-ins available sometimes. Most of them take appointments, but some of them do have walk-ins available, or sometimes they do have time to get that done. I think it's important for us to mention that we at the coalition, we don't do direct services. We don't have any direct services to the community. We just we could just guide somebody and point them in the right direction and connect them with how to get a CARS assessment and things like that. People can call us to see, make sure that assessment got done.
I'm looking at the list of agencies, and it looks like we're lacking South County agencies to assess for CARS. So if there's any South County agencies, nonprofits on this call, please reach out to Jake or Armando. I'm looking at the list, and that's a big need. Also in South County.
We actually have a deployable outreach team that's connected with community health engagement of the CSUMB.
Okay.
They are actually mobile. So if you call them, they go throughout the county and have pop-ups here on certain days. But they are also mobile
Wonderful.
Calls them and they can set up an appointment. They can go and meet them there.
There's another question I'd like to take from the chat for homeless minors whose parents are not around. Is there a way for these unaccompanied minors is there any way they could have access to housing, or how would that work?
Yeah, I don't think that we have services for under 18 minors at this point. Yeah, but we do have young adults, a host of, some programs for them, 18 to 24, but not right offhand. I couldn't tell you if we have any kind of, not with us anyway. We don't have any of those services for minors just yet.
Okay, thank you so much. And I'll take one last question in the essence of time. We only have 5 more minutes on the agenda, and I want to give an opportunity all those on the calls to give brief updates of their own agencies and maybe events. So we'll take one more question. And I just want to give you all a round of applause. Thank you for such an awesome presentation. Thank you. We'll take one more question. Is there anyone who would like to do the last question?
Yeah, with shelter, I think it was a shelter question. Is that right?
Okay, there's a last one in the chat. Is shelter available now for families that are experiencing homelessness? What support is there for a family that has no identification? They just don't have anything and they need immediate assistance.
Yeah, like Jake mentioned, the Share Center in Salinas, and the new Sprung Center, which is right in Chinatown they put that big building up. I know that they're able to take families. Those are the only 2 emergency shelters that we have at this point. There are some agencies that have shelters for families, which they're on our resource guide, and you can call them directly and access services through them. Some like the Share Center, that you don't need a CARS assessment to get into that. All you got to do is just apply or show up and fill out an application and get in there. I don't know that they have any openings as of yet right now. Like I said, I think Jake mentioned that they are pretty full always, and so
Okay.
So yeah.
Great. So we have a lot of community health workers, outreach workers, health educators on this call. If you have any brochures or pass outs or anything like that, please let us know so we can, give those to our CBOs on the call. Or what would be the best number to contact you guys directly? If you can leave your names and emails on the chat box, that would be great. Thank you. Thank you all so much.
I think Jake's putting a link to our resource guides.
Perfect.
Off of our website, and you can print it down from there.
Okay, thank you all. Round of applause for Jake and Armando. So going on to the next agenda item, organizations and sharing and networking. This is your time to shine, my agencies. Is there anyone on the call that would like to provide an update or share a calendar of events for your agency? Please introduce yourself and what you'd like to share. The floor is yours. I see Alma Mandujano's hand up.
Yes, good morning, everyone. So thank you so much, Jake and Armando. Wonderful information about the homeless. As you know, we have been having an increase, especially here in the Monterey County. So very valuable information and to everyone. I am new to Natividad. I've been here with Natividad for 3 months already. But I wanted to share that previously to that, I was with Alliance on Aging, so working with our senior population. And I just wanted to share that the open enrollment period is coming up for seniors that would like to change, add, or drop their prescription drug coverage or Medicare Advantage plans. So just wanted to give that announcement. If you or any one of you works with seniors and that population, they can go ahead and call the 1-800 Medicare number to speak with a representative that will redirect them to their local SHIP office, which would be able to help them in this aspect. I'll add some of that information on the chat feature. You can also visit Alliance on Aging, where they do have registered SHIP counselors to provide this information. And the period is October 15th through December 7th, where seniors can add, change, or drop their prescription drug plans or Medicare Advantage plans. Thank you.
Thank you. I see Dana with her hand up. Thank you.
Hi, good morning again. I'm Dana Edgell from Monterey County Behavioral Health. I shared information on the chat on a awesome community event that's coming up on September 10th at Sherwood Park. We are intentionally holding this event during September, and September 10th happens to be National Suicide Awareness and Prevention Day. An important part of taking care of our mental health and well-being is being connected in our community, being connected to resources. And so at this point, I think we have roughly 40 community agencies that are coming out. We'll have entertainment, raffles, and some inspirational speakers. So I'll share, Enid, the flyers with you, and you can please help me get the word out. I'd appreciate that.
For sure, yes.
Awesome. And then I just put in the chat a link to a great website that has information in English and Spanish to help people to get familiar, to help ask questions about to our loved ones and those that we care about and those that we work with about suicide, because unfortunately rates are rising in Monterey County, and we're hoping to help get the word out and destigmatize the topic. And I'm happy to be a resource if anybody has more questions about that.
Thank you, Dana. And also, I'd like to highlight the new phone number, please.
Yes. Sorry, Enid, I forgot about that. Yes, so 988. 3-digit number that will link folks directly to the local and national suicide prevention lifeline. So 988. Thank you, Enid, for helping remember.
Yeah. So instead of 911 for any emergencies, if you have anybody or yourself, if you're experiencing suicidal thoughts or tendencies, 988 is the new national hotline that is available 24/7. And of course, as you know, the Natividad crisis team in the emergency room is always a source. Through the emergency room, we will have the crisis team immediately assess anybody who comes to our emergency room 24/7 to be assessed and assisted. So we have the 988 and the emergency room crisis team here at Natividad available 24/7. Thank you for bringing those resources, Dana. Anyone else with their hands up who would like to share information? I know we're 2 minutes over and I like to respect time. So we'll take a few more announcements before we move on to next topic selection and adjourn. Anyone else on the call who would like to go and share? Kevin Zapian. Kevin, the floor is yours.
Thank you. I'll be real quick. Like I said, I work with Planned Parenthood. I'm a peer program facilitator, and we are looking for recruitment for our peer program that we have. You may have heard of it as Promotores, but we recently rebranded, named it Enlaces Conectando Comunidades. So in the chat, I will go ahead and drop in the flyer, as well as a link that you guys can all share for people who are interested in the program.
Thank you, Kevin. Oh, this is an amazing forum. Thank you all so much. The energy we feel virtually is just amazing. Even though we're not in person, I feel the connection of all of those that serve our community with passion and care. Just thank you for all you do every day. Is there anyone else who would want to share resource or an agency update, announcement? We have wonderful resources in the chat. We have Alejandra Garcia with her hand up. Thank you, Alejandra. And you will be our last.
Hi, everyone. So my name is Alejandra, and I work for the CHCP program, which is the Child Health and Disability Prevention here at the Health Department. And I am looking for, if there's anyone here that represents schools, I would like to do parent presentations. You guys could reach out to me. I'll put it in the chat. And then also there is an event I was invited to, but they're really looking for outreach agencies to be able to attend. It's the Dole Health Fair. I believe it's in September. I'm not sure. It's like a Wednesday, but I'm not sure. And I could put his information. His name is Oscar Cervantes. So they really need agencies to go and represent your agency and just talk. It's going to be a health fair, so you're going to be tabling opportunities. So I will be there, but if there's anyone else that does outreach and
Can you send us
can
an email
participate.
on that with the flyer and the contact information? We'll be happy to send it out to our Cisne team.
There's no flyer. He only sent like I was only able because reference, and I only have his email. So you could reach out to him, like send him an email, and he'll
Okay.
contact you.
Great, thank you. Okay, so we will go on to the next month's topic selection. We are in October. That brings us to almost the end of the year. Is there any hot topic or speakers that you would like to hear about from our community? And we will be tasked with looking for speakers on the subject matter. Please drop any suggestions in the chat box or raise your hand, and we'd love to hear from you at this time. Are there any topics that are pressing or you've heard in our community? And then you can also email your topic suggestions to montereycisne@gmail.com. Okay. Seeing none, we look forward to hearing and seeing you in our next Cisne. Please mark your calendars for the first Thursday of October. That would be Thursday, October the 6th, same time, same place. Thank you very much. Have a wonderful day.